Dear graduates, you made it. 3 years flew past, and now we are here, ready to celebrate this finish line together. How about we rewind back for a bit? So let's go back to the beginning. Nursing Simulator Lab was where we learned our very first nursing skills. We spent many hours here practicing the basics, from taking vitals to learning how to approach a patient with confidence. And honestly, the MVPs were our mannequins, Ngee, March Tan and Lechumi, for sitting through all our endless practice rounds without a single complaint. And this is where it all started, just us and these mannequins. We did not know much back then, but it kickstarted everything we learned after.
In year 1, we learned how to prescribe lenses, fit them properly, and check the eye health of our patients. Refraction taught us how much precision matters. Every test and every small adjustment showed us that the right choice can completely change how someone experiences the world. The white coat ceremony was one of the key milestones of our second year. Receiving our white coat made us realize we were moving beyond the classroom and into caring for real patients. After the ceremony, we began our clinicals here at Ngee Poly Optometry Centre. NPOC is equipped with high-tech tools like the Visual Fit, which helped us to learn how to take accurate measurements and understand how lenses fit in real situations. In every session, we learned by watching one another, practicing together, and figuring out how to improve with each round. Working this way helped us understand the details behind every step and why they mattered.
In year 2, we were introduced to simulation training, a glimpse into the real world of nursing. We used the HoloLens to practice essential skills such as checking and preparing emergency equipment. We then put our theory into practice through real-world scenarios, managing deteriorating patients, communicating in emergencies, and learning to stay calm under pressure. Everything we learned here has prepared us for real patients and got us ready for our clinical attachments. We picked up so much during our placements. The people we worked with, the teams we followed, and the patients we met taught us more than we ever expected. Not only that, we also got to learn overseas through OIP. We experienced new places and saw how healthcare works in different countries. And through YEP, we learned how to give back through eye screenings and health education.
So here we are, in our final year, finally stepping into the OT lab we've been waiting for since year 1. In the operating theatre, we learned how important sterility really is. Where we stood, how we moved, and what we touched mattered more than anything else. And of course, there were the funny moments too where someone would break sterility.
Hi guys, let's restart.
And that's okay, because we get to learn and grow together. After countless hours of hard work, early mornings and late nights, we finally made it! And here we are at graduation, standing right where all our hard work led us.
And of course, let's not forget, would you prefer lens 1 or lens 2?
So let's turn to one another and ask one last time. May I have your name and NRIC, please?
This course really strengthened my critical thinking and helped me manage complex situations with more confidence. What I valued most was the attachment to different specialty ICU. It opened my eyes to how each unit works.
Integrated nursing sciences, also known as pharmacology, helps me to better understand my patients. The basic ADL skills we learn, like assisting with daily care, transferring patients from the bed to the chair, and taking vital signs, are all things we perform every day in the ward.
What I like most about this course is that it is practical and closely related to real work in the operating theatre. I am now more confident in working.
And to all our graduating batch,
Happy graduation!